Hey everyone, I'm Angie Miller. I'm the host of Strong Mind, Strong Body. And my upcoming episode is called Feel It to Heal It, the science of emotions in motion. And so, what I talk about is that stuck emotions keep you stuck, just like stiff muscles in your body keep you stuck. But movement has the power to set you free. When you move your body, you move your emotions, and your thoughts become fluid and flexible. And I share research about how movement improves mental health in the spirit of Mental Health Awareness Month. So I really hope you'll join me in the episode. And when you're finished, I hope that you'll like, follow, subscribe, and leave a 5-star review.
Welcome to Strong Mind, Strong Body, recipient of a Gold Markham Award for Excellence in Podcasting Content. Hosted by licensed therapist and wellness expert Angie Miller, this podcast blends psychology and fitness to help you build resilience and feel your best inside and out.
Hey everyone, welcome to Strong Mind, Strong Body. I'm your host, Angie Miller. I'm a licensed clinical mental health counselor, a certified wellness coach, and someone who has spent over 3 decades living and working at the intersection of fitness and mental health. And so, since this is Mental Health Awareness Month, I'm like, yay, I get to get on my soapbox. And today's episode feels pretty personal to me because everything we're talking about today, I have lived, I've studied, and I've witnessed in the lives of my clients. So today's episode is called Feel It to Heal It. And it's the science of emotions in motion. Because my big thing is that if you don't feel all the feels, you're going to get stuck. So I want to open with something for you to consider. We'll call it kind of an appetizer for your brain to warm you up for this episode. I just want you to consider that stuck emotions keep you stuck. So just like stiff muscles in your body keep your body stuck, but movement has the power to set you free. So when you move your body, you don't just move your limbs, you move your emotions, and your thoughts become more fluid and more flexible rather than rigid and blocked. So I want you to remember that because everything that we're going to talk about today comes back to that core idea. So first, I'm going to talk about the mind-body connection. And when it comes to the mind-body connection, we know that physical movement is key, not just to burn calories and transform the body, because we already know that. We've known that since the beginning of time. But more importantly, as a way for us to process and release emotions. Because again, movement is going to help emotions move through the body. And this is critical because if you think about it, stuck emotions have nowhere to go. They breed and they fester and they make us really uncomfortable. We can become disconnected from ourselves, from our bodies, and from everyone around us. And this often is what leads to ineffective coping skills. When people keep their emotions bottled up, they're like trying to put a lid on a boiling pot of water. So it can lead to ineffective coping skills like, in an effort to get some relief, we often will numb or will avoid or will distract. And the irony is that the very thing that could help us to feel better, which is moving our bodies, becomes harder and harder to access the more stuck we become. Because the more we're holding and withholding and keeping everything inside, the more tense we are, the less motivated we are. So this is exactly why the conversation that we're having today matters, because I think that we still live in a culture that tends to treat the mind and the body as separate systems. And yes, we talk the talk and we post about it all over social media, but how many times do those in the medical field talk about movement as a prescription, and how many times do those in the fitness field talk about emotional health as, a means to get more physically healthy, right? So we see a doctor for our physical health, we see a therapist for our mental health, but rarely do the two worlds collide. So the research, though, and honestly, through lived human experience, there's a very, very different story out there. The mind and the body are not two separate entities, and they constantly have a conversation with each other. So emotions are not just psychological events, they're also physiological ones. When you feel anxious, your heart rate increases, your muscles tighten, your breathing can become very shallow. And when you feel depressed, your body feels heavy. Often you see it in people's postures. Their posture tends to collapse, their chest caves inward. The thing is that on a personal level, depression runs in my family. And movement has always been my best medicine. I journal and I move. And of course, I engage in talk therapy because I am a therapist. And while I might still struggle with anxiety, if I didn't have movement, I feel like I would truly be stuck. It's often during my greatest struggles that I can look back and I can think, if I didn't teach fitness classes, if I didn't have that community, and honestly, if I didn't have that commitment that made me show up when I least wanted to, I cannot speak for how I would have navigated the challenges of caring for my mom when she had dementia, of navigating 6 moves across the country throughout my marriage, and of grieving people that I love after loss. So the key, I think, is to remind ourselves and our clients and anyone who will listen that our emotions live in our body. And that's exactly why moving your body can move your emotions. So, for those of you who love the research, I'm going to share some research about anxiety and depression and movement in general, because I think that the common core is that therapists don't know, they don't practice medicine, right? So, and medical practitioners don't practice, they may practice movement on a personal level, but they don't know how to, quote, prescribe movement. So here's what the research says. So the connection between physical activity and mental health is not new at all, because as far back as 1988, this is 2026. As far back as 1988, there was research that demonstrated a positive correlation between physical activity and mental health. And in that research, they define mental health as having a positive mood, having general well-being, and relatively infrequent experiences or symptoms of anxiety and depression. And since that time, since 1998 or since 1988, excuse me, researchers have been building on that foundation. So there's some really current research out there, and it's a very comprehensive study. And it's, from what I could find, the largest synthesis to date. But physical activity in that study was found to be comparable to, and in some cases, even more effective than antidepressants and psychotherapy when it comes to reducing symptoms of depression and anxiety. So that was done in 2023 by Singh and colleagues. And I think that that's pretty remarkable, because even though I sit here as a therapist and I would like to tell everyone that I think talk therapy helps, I also, again, sit at that intersection and I know how provocative and profound movement can be. So, it can be as stated, it can be as effective, if not more so, than talk therapy and antidepressants. So talk therapy, though, and medication obviously have their place, right? I am not anti-medication. I am not pro-medication. I am all about meeting you where you are. And if medication helps and pharmacology can go alongside movement and other things like talk therapy, fantastic. But I'm not really a person who thinks that it's one without the other or it's one in place of the other. So yes, medication and psychotherapy have their place, but physical activity, honestly, is a very underutilized, under-recommended mental health intervention in our kind of global society. So I want to be precise because I think precision matters. The research that I just shared shows a strong and a consistent correlation between exercise and reduced symptoms of anxiety and depression. And keep in mind that I'm saying correlation, not causation, right? So we can say with certainty that if you exercise, it will, cause these improvements because other factors could be at play. But what we can say is there's a strong correlation, it's consistent correlation, and it's evidence-based. Because generally, if you move your body, you move your emotions, you feel more positive emotion, therefore symptoms of anxiety and depression go down. So that's where I'm going next. That is what we effectively call a bidirectional relationship. And I think it's important to name, and it's something that gets left out of the conversation, that the relationship between movement and mental health is bidirectional. It goes both ways. Yes, movement improves mental health, and we're going to spend time on that. But the other side of that is just as important. Our mental health affects our ability and our desire to move. And if you've ever struggled with anxiety or depression, or you know someone who has, you know that it's not as simple as saying, hey, you should just go exercise. When someone is deeply depressed or they're deeply riddled with anxiety, telling them what they should do is not going to help, right? Like, of course, they know that they should do these things, but if they could, they would be doing them. But because of the effect of the depression and the anxiety, it can feel very debilitating. So think about what depression feels like. It's heaviness, right? It feels like you're carrying around a weight, like a backpack that you just can't quite keep on your back. It just feels like too much to carry. And it often will lead to a loss of interest or pleasure in things that you or the people you know and love used to enjoy. It's usually associated with low energy and social withdrawal. For people who are truly depressed, getting out of bed is an accomplishment. You telling them to go get on the Stairmaster for 30 minutes is like telling them to walk to another country that's, thousands of miles away. So the idea of putting on workout clothes and going to a gym can feel impossible. That's why just saying, just go exercise is not only unhelpful, it can be very dismissive, and it can feel very painful to a person who is in the throes of depression. So anxiety, what does that feel like? Often anxiety feels like hypervigilance, right? Somebody who feels like they're constantly in fight or flight. It often will lead to fatigue because think about always being hypervigilant, always be on the lookout, always be in a fear state. It can make even leaving the house feel threatening. So from my practice, what I do with my clients in mental health, I present it as an invitation. It's not a prescription. It's not an expectation. It's not a should or a must. It's an invitation to move. And I invite them into different simple practices that are movement oriented. It could be 10 minutes of stretching. It could be simple breathing exercises. It could be walking. And then I will even show them simple stretches that they can do throughout the day, especially if they sit a lot. And I tell them the key is to start very, very small and have, very kind of minimal expectations, if you will, and just invite your body into these different practices. Give it a few weeks. And then I ask them, how did you feel when you added that 10-minute walk at lunch? Or how did you feel when you added that 30-minute walk after work? Or how did you feel when you did those breathing exercises throughout the day? Because I really want them to think about, what does this feel like in your body, instead of, did you lose weight? Or, because none of that matters to them at that moment. So let's go into some specifics, right? So I'm kind of talking about this bidirectional relationship, but I want to share just a couple of bits of research when it comes to anxiety. So anxiety, but also depression. So there was a review of 49 studies that evaluated exercise versus other forms of anxiety reducing treatment. and results demonstrated greater reductions in anxiety in those who engaged in exercise. The benefits even included anxiety reduction, whether they were male or female, no matter their age, and even those who were diagnosed with anxiety disorders. So those who were in the exercise intervention always experienced reduced symptoms of anxiety. And what I find really compelling, because this is always the big question. Well, how long do I exercise? At what intensity do I exercise? Because everybody wants a prescription. We're so prescriptive, right? We want to know, is it 30 minutes? Is it 20 minutes? Is it the Stairmaster? Is it the treadmill? And so what they said in the research was anxiety was reduced after exercise, regardless of intensity, regardless of duration, and regardless of the type. Right? Mic drop there. It doesn't have to be so specified. It's just inviting people into movement practices and letting them know that they have autonomy, and whatever feels good to them is what they're going to want to keep doing. Because the more we give people put them in the driver's seat, put their hands on the wheel, the more they're going to feel empowered to do what feels right for their body at that time in their lives. So that's a little bit about anxiety, but what about depression? So there was a large meta-analysis that supported that moderate, and this is important, that moderate intensity exercise as an evidence-based treatment for depression and even major depressive disorder, right? That it was evidence-based that it would help reduce depression. Again, even in those with major depressive disorder. And yoga deserves a mention here, because I know that not all types of yoga fit into this category, right? I've been to yoga classes that actually stress me out. They're doing a lot of inversions, or it's super hot in the room, and it's a kind of yoga that I'm like, oh, I can't do this. So not every yoga fits into this category. But yoga has also, there's research that shows that it has a significant positive influence on reducing symptoms of depression. And here's the physiological reason: because low levels of the neurotransmitter GABA are associated with anxiety and depression. So usually when you feel anxious and depressed, your GABA levels are low. But GABA levels have been shown to increase with consistent yoga practice and deep breathing exercises. Because think about it, yoga counters the physical postures that depression creates in the body. So remember I said, kind of the chest caves in, the shoulders round, the head tilts. You can see it in people's physical posture. Yoga counters that. Yoga is all about breath. It's all about opening. It's all about softer, more intentional movement. So think about how that aligns with an invitation for people to move their bodies in a way that feels kind and inviting versus, I want you to go beat yourself up. And by the way, you'll probably feel better if you do. So when you physically open the body, you create space for emotions that have been held inside. You create space for them to move and to shift so that they're not so locked. And then on the resistance training side, when it came to depression, there was a meta-analysis of 33 randomized clinical trials. And it found that resistance exercises significantly reduce depressive symptoms in adults, regardless of health status and regardless of whether their strength improved. So in other words, you don't have to get stronger to feel better. Just them engaging in resistance exercise carried an antidepressive benefit. So, what we're hearing here, if we're hearing anything, we're hearing more moderate intensity, but we're not hearing you have to do it for 30 minutes. We're not hearing a prescription for a type of exercise. But what we are hearing, again, moderate intensity or even lower intensities of yoga where breath and posture are so important. So movement impacts overall mood. And when we have more positive emotion, we are less inclined toward depression and anxiety. So beyond anxiety and depression, there's research that says that exercise improves our self-acceptance and it improves our ability to engage in positive relationships. It helps with personal autonomy and growth. it's kind of drives that more growth mindset versus fixed mindset. It also helps those kind of have experience more purpose in life and more pleasure. And all of those are dimensions of well-being and essential components of good mental health. And I'm going to give you the research that I pulled all this from. We'll put it in the show notes so that you can look at the research yourself if you want more details about this. But exercise as a whole improves our perceived competence and self-efficacy. So it gives us this belief that we have the ability to produce results. And that's what self-efficacy is confidence. Because when you feel capable, you're more willing to do the hard things. You're more willing to show up for yourself. So I always say that body confidence transfers to confidence in everyday life. So the more empowered I feel in my body, the more empowered I feel to face my fears, the more that I'm inclined to take action, to find strength from within to persevere through difficult times. My body and the way that I move it are my greatest resource that I pull from when I'm facing challenges and when I want to find joy. So I know that, again, coming from a family where depression is rampant and coming from a family that is not necessarily natural movers, if you will, when I discovered movement and exercise, it was transformative for my personal life and the way that I age and the way that I deal with difficulties is very different from many other people in my family. And I always attribute it to movement. So, does the type of exercise matter? And I know I've been saying it throughout, so I kind of want to touch on this so that we're very clear. Everyone wants to know, is one type of exercise better? Or I read about Tai Chi and I read about yoga. Okay, yes. And you probably could find research for each type of exercise that you love. But one study looked at aerobic exercise, circuit training, and Tai Chi. And it found that all three produced significant reductions in anxiety and it improved feelings of anger and tension in the body. So each modality resulted in the same effect. And that's powerful because that tells us that the best exercise is one that people are actually going to do. You could tell your client, oh my gosh, I found this great article and it says that Tai Chi is great for depression. But your client is used to doing HIIT classes. And your client's like, yeah, that's great. But I love my HIIT classes. And why would we then hit them the article and be like, no, it's Tai Chi? I say, let them do what they want to do that makes them feel better, right? So that said, when it comes to intensity and type, there were some specifics that came up in the research kind of over and over again. So again, resistance training at low to moderate intensity, specifically less than 70% of 1 rep max, produced the most reliable and the most robust decreases in anxiety. Moderate intensity training also produced the greatest improvements in affect, which means that moderate intensity resistance training led to more positive feelings and emotions. I do think this is worth noting because here's the deal, and this is really important. They said that resistance training at higher intensities actually were shown to have the opposite effect, particularly for novice exercisers. So in other words, when they went too hard or too long, it had the opposite effect. It didn't reduce anxiety. So the goal for most people, keep in mind, is to maximize pleasure and avoid pain, to choose activities that make them feel good, not bad, right? So if they're going home, they're super sore or they're exhausted, exhaustion depletes the stores that we have in our body, right? Like if I'm exhausted, I am less emotionally present, right? All I can think about is being tired. I'm crabby. So we don't want to get them to that state. The thing is that consistency is the word that comes up again and again, right? Research makes it very clear. The effect of exercise on anxiety and depression is not permanent, right? Pre-exercise levels of anxiety returned within 24 hours of exercise, and sometimes as soon as 4 to 6 hours. So in other words, you don't get to go work out, store it in your exercise bank and be like, oh, thank goodness, because I'm going to the beach for a week and I'm not going to have any time to exercise. It doesn't work like that. We don't get to put it away and then take withdrawals when we need it. So those pre-exercise levels of anxiety are going to come back within 24 hours and sometimes less. So consistency. So longer training programs that were conducted over weeks versus hours or days are what lead to lasting change. It's not discouraging, it's clarifying news. It tells us exactly what we can prescribe to people. Regular, moderate movement, sustained over time. There it is. There's your prescription. So what does this look like in practice? Here is kind of a summary. Aim for moderate intensity movement, 20 to 30 minutes, 3 to 5 times a week. Prioritize consistency over intensity, especially if your clients are navigating anxiety and depression. Remember that resistance training at low to moderate intensity is particularly effective. And yoga and breath work are powerful adjuncts, especially for depression. And probably the most important one, frame movement around quality of life, not appearance. It's how it makes you feel, not how it makes you look. Okay. So keep in mind that knowing all this doesn't make it easy. Motivation is complex. And for people living with anxiety and depression, the gap between knowing what helps and actually doing it can be enormous. So there was a study in 2017, and it found that something simple, like a recommendation from a physician or another healthcare professional, had the greatest impact on facilitating exercise engagement. So this is a call to action. If you're a coach, if you're a physician, if you're a clinician, if you're a fitness professional listening right now, your recommendation does matter. Your encouragement matters. The words you use with your clients about movement and mental health can have a real impact. Movement doesn't have to be a workout to move your emotions. It just has to happen. So if you're in a hard place right now, or you know someone who's in a hard place and they want to move, but they don't have the energy or the motivation, I hope that you'll tell yourself or them this: start small, so much smaller than you think you need to. Remember that movement is an invitation. It's a soft calling that can help you resolve whatever you're facing. It can help you get unburdened and unstuck, one step and one bead of sweat at a time. So we started today with the idea that stuck emotions keep you stuck, just like stiff muscles keep your body stuck. And the inverse of that is equally true. When you move, you free something up. You create flow where there was rigidity, and you create space where there was constriction. So this is Mental Health Awareness Month. I hope that you'll share this episode with someone who needs to hear it. And if you're a fitness or a wellness professional, consider this your reminder that the work you do is mental health work too, right? You're not a mental health practitioner, but the work you do improves people's mental health. So every time you help someone move their body, you're helping them move toward healing. So I'm Angie Miller. Thank you for listening to this episode of Strong Mind, Strong Body. And until next time, I hope that you will take care of your mind and your body.
Thanks for spending time with Strong Mind, Strong Body. Angie will be back with more tools to help you feel strong and centered. Like, share, and subscribe.